I want to welcome everybody to the Opioid Committee this month. If you'd please make sure that your cell phones and are muted, that would be great. Thank you, Legislator Fagione, for the use of your flag. If everybody would please stand up and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America.
And to the republic which it stands.
One nation, under God, indivisible,
liberty, justice for all.
Okay.
I'll take roll call for you.
That would be great. Thank you.
Oh, you're here. Okay, great. Thank you.
Oh, great. Take that.
Okay, Hines?
Here.
Today. And Stassi?
Here.
Sutherland?
Here.
Okay, we have 3 present and 2 are absent.
I'm sorry, who are the 2 that are absent?
Looks like Luhan has not joined the call yet, and I know Darcy was not able to make it.
I'm present.
Oh, you are? Okay. All right, Kevin Darian is here.
Sorry about that. I didn't hear my name.
Okay.
Good afternoon,
So
everyone.
we have Darcy out.
And I know we have Deputy Commissioner Lacey Trimble here, on behalf of Commissioner Miller, so thank you. So if we could start with Angela Jo Hines from Managing Director of the Mental Health Association. If you wouldn't mind giving us, first of all, thank you for being here, and give us a little bit of a report on how the 311 call number is doing.
Okay, I appreciate the opportunity to present. Let me turn off my speaker. I don't have video, so I apologize.
That's okay.
So we went live April 1st, 2019 with the 1-800-832-1200 number, and we were able to go live with the 311 three-digit on May 1st, 2020 of this year. I collected data, which we do monthly and weekly, and we also do it for specific grants. So I've got some data for you today. Since going live up until August 31st of 2020, we have taken a total of 40,000 calls, 694. Just to give you a little understanding, we are obviously 24/7. We have 13 clinical staff, 17 non-clinical, which means they have to have a bachelor's or higher. We have some staff with PhDs and different things, but clinically, we make sure that there's a clinical staff on every shift. And we also have on-call where there's clinical staff available, whether it be because we want to support a bilingual program participant or client, but we have a total of 30 staff. If I break down the calls for substance use, I'll be honest with you, when we first started to collect, some of the data was put into general because of the fact that the person had a primary diagnosis of mental health, and the underlying issue why they were originally calling the call center was mental health. Since last year, we started working on breaking out those numbers and identifying general substance use and opiate calls. So of the 40,694, we have been able to report 100% on 357 general substance use calls and 165 opiate calls. But as I mentioned, when we went through and started looking at the person that might be calling with co-occurring, typically we have a lot of individuals with the substance use. And so this year our target is to be able to better capture how many substance use and how many opiate calls. One of the things that the call center does in partnership with the police departments in Orange County is the crisis intervention. So of those 40,000 calls, we supported 869 crisis intervention reports and follow-ups. Developmental disabilities, 111. So again, even with the developmental disabilities, they would also include some of the substance use. So we're trying to better accurately report out on those. Since February with the COVID, we started tracking just disaster relief. So since February, we've had 4,598 calls specifically to disaster relief. We get a lot of information referrals, so that could also include people wanting to get into treatment, that kind of stuff. So that's 3,825. And as I mentioned, our largest number of calls is mental health, which is 15,035. We do have a category of other, which is almost 10,000 calls, and the other is often somebody that is looking for 311 in the city, but we still try to determine if we could be helpful as well. Our rate prices program goes through the call center as well, and they've had 375 calls. And our Text for Teens, which is a texting program, goes through the call center, and that equates to 687. So although the numbers for substance use seem low, we do capture in the back end the idea of co-occurring. And so we hope to next year to be able to give you a better idea of substance use being the primary versus it being the secondary for the individual.
Okay, thank you. I think it's great, no matter how you field those calls, that we have this for Orange County. Does anybody have any questions?
So if I could just add, through some DOH funds, the Department of Health, we are creating kits, and these kits will be given out when someone has overdosed. So the kit will have information about the call center. It will have a Narcan kit. It will have information for family members. So we're excited to add to that. And then anytime we can send out the mobile response team or a peer, we definitely connect them to those services as well. As you all know, it's a true collaboration between Mental Health Association, Access Supports for Living for the mobile response team, Independent Living for the peers, and obviously our local government unit through the Orange County Department of Mental Health spearhead this whole amazing initiative. So thank you for the opportunity.
Thank you. Anyone have questions? Comments?
Hines?
Yep.
Kevin Hines? Yeah, so when you get a call to 311, do you send police, ambulance? Do you send mental health? How do someone determines that? Or do the police always come with the mental health unit? How does that actually work?
Very good question. So when the caller comes through, we always take the Welcome Orange approach and thank them for calling, identify who we are, try to assess what the situation is. I'll be honest with you, we do have a list of individuals that require the police to go out, but typically we will reach out to mobile response team. They will make an assessment as well, and if they're known to the person, but obviously we don't come with sirens, that kind of stuff if we don't need to, but there's a lot of police interaction. Think about 869 crisis intervention team calls that we've been able to work with them on and connect them to a peer. So a lot of times it's just us taking a call. A lot of times when we get done the call, we'll definitely offer the opportunity for mobile response. And there's times where the police are already on the scene and they're struggling with somebody's mental health versus arresting them. They will call the call center first. They will give us the information. We'll reach out to mobile response and they will join them on the scene. So that will either, and I'm sure Lacey will go into more detail about that, but determine whether or not this person needs to be hospitalized, whether they're voluntarily willing to go, or do they need the Orange County Department of Mental Health endorsement to say, yes, this person needs to be documented as not being able to make decisions for themselves. So most often the calls are not involving police. They're involving the person taking the call and they're involving mobile response responding. And then anytime, I would say 75 to 80% of the time, the person could benefit from having a peer because they're not already connected. We would then connect them to a long-term service so that they have someone that's working with them. And then we look at everything from care management. Do they need to be connected to housing? Do they need to be connected to a physician? So we start giving referrals as well. So we always assess every call. We always determine what's in the best interest for the call. And then safety obviously is paramount. But when there is the potential for an unsafe situation, the police will be called to go out.
Okay, thank you.
You're welcome.
Okay, any other questions? No? Okay, thank you, Angela, so much for coming and for your time and for all you guys are doing over there at this call center.
Thank you so much.
Bye. Okay, so with us for Commissioner Miller today is Deputy Commissioner Lacey Trimble. Thank you for being here.
Thank you for letting me come in her place. So I did run the ODMAP data for everyone here. Just want to reiterate, I'm sure you're all sure that the ODMAP is suspected overdoses and fatalities. The official numbers come from the medical examiner's office, which I did follow up with them just to make sure, but I'll give you both. Just for some background, 2018 was our highest year with 118 fatalities as a result of an overdose. In 2019, the medical examiner has confirmed 110 overdoses, 97 of them being related to opioids, which is over 88%, so a high number. That was actually a decrease of 7% from 2018 to 19, which is a good thing in our county considering the fact that nationwide there was an increase of almost 5%. So where most of the nation was seeing an increase, we saw a decrease. Unfortunately, between COVID and other situations, we are not looking at that this year. So far, we have January 1st through September 15th, 362 suspected overdoses with 111 fatalities and 124 naloxone administrations. These are unconfirmed numbers. These are suspected, and they could be higher or lower. The medical examiner's office has finalized 73 of them as being overdoses so far, with 67 being opioid related, so almost 92%. Testing, go ahead.
I apologize. What was the number of suspected deaths there?
The suspected fatalities was 111 for this year. With the ME's office being 73 confirmed so far. We have seen in the past where some of the numbers in ODMAP go down because they've removed duplicates and things like that, so the numbers could shift from over time. The medical examiner's data does not include July or August yet. It takes 6 to 12 weeks for the testing to come back, and if they need more extensive testing, could be longer. So the 73 is through June. Our monthly average is at 11.7 lives per month if the 111 becomes an accurate number. But we have to keep in mind that as of September, we're only seeing through September 15th, 1. And that is likely not going to be the final number for that time period. I ran these numbers originally on Tuesday. I reran them today just to confirm, and there was a 5-person increase in fatalities that were not attributed to September. So sometimes the data does come in late. Right now, it's looking like May was our highest month with 24 fatalities suspected in ODMAP. Percent change over last year, according to the ODMAP data, which again is just through January through September 15th, is a 23% increase in suspected overdoses, a 42% increase in suspected overdose fatalities, and a 30% increase in naloxone administrations. This is a trend we're seeing nationwide. ODMAP is seeing 42% fatality increase across the board, across the nation, which is different than what has come out from the White House, which saw an 11.4% increase, but they only looked January through April for that report. ODMAP also is not all areas. Not every state and not even every county in our state is reporting into ODMAP. We are seeing it's still, fentanyl is one of our worst substances that we're seeing here. Fentanyl and heroin are the most that we have outside of unknown because they're not determined yet. With fentanyl, 95% of the suspected fentanyl overdoses have been fatal, where with heroin, 24% of the suspected overdoses have been fatal. We are also seeing an increase in alcohol substance use and treatment in the hospitals, with more people coming in for alcohol use, which coincides with the increase in alcohol sales, which has been about 25% nationwide since the pandemic started. So that is our current data. Any questions? Yeah, not good news this time.
Barry, are you raising your hand? Oh, no, I'm sorry. Go ahead, Legislator Lujan.
Thank you, Chairwoman. Just a quick question. Would you please send this data to all legislators in writings, just so that we all have, so everyone has that information? I know that this is definitely with everything that's going on. I also know that we're seeing rises in domestic violence. We're seeing rises in homelessness. We're seeing rises in suicide rates. I mean, so and then now it's to hear that we're also seeing rises in substance abuse. Unfortunately, there's definitely a correlation there, and it's truly saddening to see that this is a global, not only a trend here in Orange County, but across the country. And I'm also hearing across the globe. So I just want to thank you for all your hard work and everyone that's working on this. And what are some recommendations on things that we could be doing differently here in Orange County to step up our efforts? Is really, I think, what I believe all of us would like to know. What can we do to help? What can we do to further push back on this horrific numbers that we're seeing?
So I can definitely send the data out. And just to reiterate, when you are speaking about the data, the medical examiner's office has asked us to be very clear that these are not the confirmed numbers at this point. So we try to make a point of sharing both pieces of data because we don't know yet on a lot of them. I think part of what's happened is people didn't realize what was open and what was not and what was still available. OASIS and OMH, which are the licensing agencies at the state level for all of the substance abuse and mental health providers, have really relaxed the regulations under the governor's executive orders to allow for telepractice sessions, telephone only for those who don't have the option. They've reduced the amount of time that you have to be face-to-face with someone in order to bill, to try to make sure that financially agencies could maintain their services in the same way they have in the past. They're allowing for telepractice to be used for MAT induction, which never was allowed previously. So under COVID's emergency orders, we have a lot more flexibility, but the success of that flexibility has varied from provider to provider. We had one of our local providers who was able to increase their services to the community by 40% during this because people aren't no-showing. You're calling them, so you don't have to rely on somebody to get to their session. We've had other providers who've reported really struggling to engage people in the new mode of practice. I can speak for our county clinics and say it has been very successful having that type of connection. Clients who struggle for a variety of reasons, whether it's transportation, just their symptoms getting in the way of showing up for appointment, are now attending their appointments, and our no-show rate was cut in half during this. So I think part of it is that when the epidemic first started, when the pandemic first started, hospital level services were harder to access. There weren't enough tests available. You couldn't get inpatient treatment originally without a negative test, but you couldn't receive a test if you didn't have symptoms. So people who were trying to access higher levels of care really struggled. And the isolation has been a big challenge for a lot of the clients, not being able to see somebody face-to-face on a regular basis. So we've really tried to get the 311 number out there to let people know that they don't have to figure it out, that we can help them connect to whatever service they need. And I think the more we can get that message out, the better. We did increase marketing with 311 recently and have billboards with the new number up, a radio ad specific to the opioid epidemic that was placed. I think it's really a communication and getting the word out that the services are available despite all the restrictions that are in place because of COVID.
Thank you. Does anybody else have any questions for Lacey? No. Well, thank you so much. Unfortunately, these numbers are staggering and very sad. And we hear about it more and more every day. So thank you for everything that you're all doing over there and that you continue to do.
Thank you.
Yeah, thank you. Okay. So that way we can segue into our next guests. I invited Annette Kars and Chief Blasco with us from Hope Not Handcuffs and the Police Chiefs Association to talk a little bit about the success that Hope Not Handcuffs has been bringing to the communities. and what role they have been playing in helping those with addiction. About a year and a half ago, we had first started talking. I want to say it was about a year and a half ago. We started talking with Annette and Laura Beck from Hope Not Handcuffs when they first came to the opioid meeting when Legislator Sassy was, our chairman, and came and that's when they first told us about themselves and what they did for us. And then a few months later, we were able to go through public safety and the Police Chiefs Association and help them out with an appropriation of $10,000 to help them do what they need to do to be successful. And so I invited them back because as we, listened to these numbers and we hear the staggering statistics, I thought it might be something that we really want to consider doing again and helping them out. So Annette and Chief Blasco, if I can turn this over to you and you can share a little bit about what you've been doing and what you would still like to do. We can go from there.
Sure, I can go ahead. Chief, do you want to go first, or I don't want to? We'll go in order of rank. I mean, if you want to go first.
Ladies before gentlemen. You're good.
So thank you so much for having us today, and thank you for again for the $10,000 that was appropriated for us, because it has been incredibly important to us. We are, a small nonprofit, and where someone else $10,000 might not cover a lot, to us it means the world. We've been able to do so much with that money, so I want to thank you for that. Some of our updates or statistics are that, a year and a half ago when we started this program, this PARI model, which is a nationwide program, we never had any idea how it was going to explode. We started with one police department, and now we've grown into 15 in Orange County. We're also in 3 other counties and starting in our 5th county. So we have 30 police departments currently. And 2 more currently in waiting. We're launching in Westchester now. The largest area of our program is definitely Orange County with the 15 police departments. So the bulk of what we do is here, and also the bulk of the phone calls and the people that we help are here. So just to give you some idea, in 2019, I think some of you have the information I provided, but we were taking on an average, we use something called Grasshopper line. And actually, we're really lucky with that line, because the line, when you call the number, it is broken down in a prompt. So it's 1 for Orange County, 2 for, Dutchess County, and so forth. So we are able to do metrics in our data based on the county. So the numbers are 100% accurate. So we took about 24 calls a month in 2019, and in 2020, our calls have more than doubled. We take about 55 calls a month. They are strictly substance abuse related calls, no other than that. Occasionally, we may have people who are a little bit more into the mental health piece of it, and then we always refer to 311. We do refer to 311 on pretty regularly if it's not something that we can handle. So approximately about 500 calls in 2020 so far. Okay, in 2019 we did 114 intakes that were people were getting into treatment, and now we're doing we did 188. So a total of 302 intakes that we have done in Orange County. The program, all areas, is about 364. We did 2 today. You can see the bulk of what we do being 302 here in Orange County and 360 in all counties is because we have the bulk of the police departments here. We're very lucky to have 3 digital billboards through the town of Walk Hill that we've had since the very beginning. So that being said, that's a huge piece of exposure right there. We started asking our participants, or people that would either call us or come to the police department. We know how they found out, but we asked them how they found out about the program. And generally, some of the things that they're saying to us is through either an angel referral, so all of our volunteers know people, so that way someone told them, police referral. We're getting a lot of that now. We've started doing a little different training with our police departments, and we're starting to utilize more officer referral, which is a really great thing. They have cards that we've provided to them with the money that we've been given, and they are able to use those cards in situations when they know that someone could benefit from getting help. Oftentimes what we will hear is maybe the police department will show up to an overdose, do a reversal with Narcan, and then maybe the person will refuse medical care, and so they can leave one of our Hope Not Handcuffs cards, tell them about the program, let them know that there is that help, and the person oftentimes will call us, and we've had several situations like that, and we will follow up with the police department and let them know that that person called us and that we were able to get them into treatment, so that we do that follow-up work with them. What we basically spent the money on, well, a couple things. The money was allocated for billboards and printed materials. We have done billboards. This is our only funding for this program, so I am very, very careful on what I spend. We had been given, a couple of state senators had given us about a $13,000 grant, and unfortunately we have never received that money. It was given to us last summer. We've never received it, and we will not be receiving it, we've been told. So because of that, because of COVID, because of our fundraiser that we do annually, which is our paddle run, we raise about $30,000 with that, our kayak and canoe race, and we are now not able to do that. We're doing virtual like everybody else, right? This year, we usually do about 30,000 with that. This year, we'll be lucky if we hit the 7,000 mark. So I've been incredibly careful with what I've been spending to make this money last, and that's the truth of it. It could have been gone before now. Billboards are extremely expensive, so I've been spending more money on printed materials. We spent $5,544. I have $2,100 pending expenditures, and it left about $2,300. Again, that could be gone easily. I'm just trying to make it last. So some of the things that we've been having some obstacles with, just general information about, I can echo what Lacey's saying. Definitely the numbers are way up, obviously. Mostly, I would say alcohol and cocaine. Cocaine, crack is what I feel like we see more than anything right now. Definitely heroin too, but it does seem to be a lot of cocaine and a lot of alcohol. Most of the facilities are about 50% bed capacity right now. I don't know if that, Lacey, do you know if that has been upped at all, or?
It varies by hospital what their capacity is and what the state's allowing them to do, because they have reduced some beds for surge capacity and kind of rearranged things. But we still have technically all of the space and number of beds we had before.
Yeah, it's been tough. When we first started, we were able to get people in treatment really quickly, and then now it's definitely taking us longer. We do stay in touch with them as well, just to make sure if we aren't able to place someone, we always make a safe plan. Sometimes that's when we'll reach out to 311, or several of our angels are now peer recovery coaches. So I'm actually a peer recovery coach as well. So we've been making sure that we stay in touch with the people. But it has been challenging. There's no question about it. Finding beds now. I'm trying to see. The other thing is that we've been doing, we started as a pre-arrest diversion program, but with bail reform, we have been doing quite a bit of post-arrest work as well. So we always say to the police departments, regardless of how they get in the chair and you refer them to us, we will come in and do the same process regardless. So we have been doing some post-arrest work and some pre-arrest work. The post-arrest work is usually just low-level offenses. They've been arrested, gotten their appearance ticket. They're going to go in front of a judge in a couple of weeks anyway. So oftentimes the officer's discretion can say, if you would like treatment, if you'd like help with your substance abuse issue, then they will call us and then we'll get them into treatment. Then they're going to come out, they're going to go in front of that judge, and they're hopefully going to be in a better situation in front of the judge. So regardless of what their motivation is, they're going to get help, and that's the main thing. So that's about it. Interesting thing or nice thing was we were reached out to by the International Association of Chiefs of Police, the IACP, and they are we were interviewed for about 4 hours, and there will be a published case study about the Hope Not Handcuffs program coming out very soon that the chiefs will receive too. So that's kind of cool. So
Yeah, that's great. That's
Yeah.
great. Chief Blasco, would you have anything you'd like to add and tell us about?
No, we just want to thank the legislatures for all their support and everything that the chiefs do, and also with this program. I could tell the chiefs speak about what we do with the program. It's got success across the county, and chiefs that are not involved or they want to become involved. And here in the town of Crawford, we use them several times. And I try to, especially if it's during the day, I'm here because Mr. Sassy knows at night I don't like to be at work. I've been able to try and convince people, but the real bonus has been the angels that come in are local people that our addicts know, and they're able to kind of take my sales job and help get it right into treatment. It's a kid I played Little League with a couple years ago. He didn't want to go, and one of our mutual friends' kids was an angel, came in, and she talked him right into it, and he's now been in recovery for, I think, 7 months, 8 months in it, I think, something like that. And his mom calls me and sends me messages all the time. So, the angel's personal touch is, I think, really good. And it's a great tool for us to combat not only the drug problem, but the bail reform problem.
Sure. Okay, thank you. Before we start, I see Chairman Brescia has a question. You're muted.
Sorry about that, Chairwoman. Not a question so much as a comment. I just want to thank you as Chairwoman and former Chairman Rob Sassy for lobbying for the $10,000, and I'm sure we're going to pass it in October. And I'm sorry to hear the state didn't come through on their end with the money, but I commend Annette and the whole group for all the effort you do, especially with the opioid crisis getting worse during the pandemic. Can't thank you enough, and Chief Blasco for getting the word out there and doing all the, it's unbelievable what you're doing, and I'm glad that we can help in some small way on behalf of the legislature. Thank you again.
Thank you. Anybody else? Any thoughts or questions? Legislator Bonelli? Chairwoman.
Thank you very, very much. And Annette, thank you and your group for all of your efforts. Obviously, we can see that our money has been well spent, but I do have a few questions, and thank you so much for the summary, because that was very, very important and very helpful. And it's just a small one, obviously, because I just live around the corner from Washingtonville. In your pending expenditures, your encumbrances, you say the expansion of Washingtonville. Does that mean Washingtonville is new to the program, or they're expanding the program even further?
Yeah, no, so that just means that they are waiting to come on board. I just sort of put that there because they haven't officially launched yet, but anytime actually. It's just a matter of coming and getting together. But they've already committed. We've already worked on the policy together. We had a couple of police departments that were in waiting, and then COVID hit, and so everybody we stopped sending our angels into the police department right when it hit, because obviously it felt irresponsible of us to do that. So we stopped that, but we did, as a matter of fact, we did more placements during that time period during COVID by phone, which was crazy, than we were even doing before with the police departments. But because they were waiting, we did put everything on hold, and now we're making our way, so they're ready to go. So that's basically just saying that that's the expansion in Orange County.
Okay, and one further question. also for the previous monies, you have a balance of like 2,300 and change. Do you have any plans for that particular money? And which leads me to your plans for the future for the hopefully upcoming disbursement as well, as we try to bring 2020 to a close.
Yeah.
Or are you along the same types of lines? I see that there's training in there. Are we looking for additional billboards? What's kind of your vision on how that money is going to be spent?
You know, the billboards, I have to tell you, if I did just billboards, it would be gone in about 3 months. I mean, billboards, as you well know, are incredibly expensive. And I think in looking at the metrics and the demographics of the people and what we're working with, like Lacey was saying, transportation is often a big issue with people. Oftentimes we have to provide transportation the police will provide transportation occasionally. We use Medicaid transportation. The family or friend can take them. So we'll use sometimes Uber, Lyft, or a cab. But because transportation is an issue, we just don't always feel that billboards might be the right idea. It might be more lawn signs and more local signs. So I think I would not do as many billboard type advertisements, maybe do a mailer. The lawn signs is always an important thing, making sure we have plentiful amount of flyers and rack cards to go in colleges and pharmacies and corner stores, gas stations. I mean, all of that cost a lot of money. I would also like to be able to put our bin supplies in with any future grant monies, because each bin has many items in it: comfort items, toiletry kits, clothing items, emergency clothing, some snacks, a lockbox, a binder, and all of its materials and things like that. Angel trainings and copies, and a lot of that was not in there. So we were trying to figure out other ways to pay for those types of things. So I think, and also, additional training for some of our angels to become peer recovery coaches is the desire's there for a lot of them. It's just not being able to pay for it. So
well, I do think that you utilized the money very wisely, and you did disperse it as best you could for the various different aspects of your needs for the group. So I commend you for that, and thank you. I appreciate it.
You're welcome. Thank you.
Okay, anybody else have any other questions? Okay, so not hearing any, I guess now, Legislative Council, you're here. Now would be a good time to, actually, I want to just clarify, Chairman Brescia, this would actually be going in front of Public Safety, Ways and Means, and but I'm also hearing possibly Rules next month, so that this would come to a vote in November, if I'm not mistaken. Is that correct?
I thought it was just going to be in the legislative budget, which would fall under rules. But I could stand corrected. I don't know. But I don't know if we need to go through 3 committees. I wouldn't think
okay.
2 committees.
Antoinette, are you there?
Which 10,000 is not a huge.
And I know the money is there for it. Yes.
Right, the money is in the legislators' budget, so you would go to rules in October. Just don't forget that October is budget hearings.
Okay, so we don't have to, so even to have it go through to the Police Chiefs Association, we just have to go through rules.
Correct.
Okay.
Because the money's already in your budget. So
right,
you're
it's already in the
authorizing
budget, so.
Right, so you would be authorizing the chairman to execute a contract with the Police Chiefs Association, once again, for the $10,000 for the Hope Not Handcuffs program.
Okay. Would somebody like to make a motion to have that happen?
Hines.
Okay, second?
Second, Sassy.
Okay. All in favor?
Aye. Aye.
Aye. All opposed? Okay. Okay, terrific. So that's everything. I guess I will, Annette and Chief Blasco, maybe if you don't mind, we could do this again next month. I'll talk to Legislator Fagione, Chairman Fagione of Rules, to have us placed on the agenda, and we'll go from there. Sound good? Okay. All right. Well, everybody, thank you so much. And I guess this concludes our meeting, and have a good day.
Thank you.
Thank you, Jen.
Thank you.
Thank you.